right. Hello and welcome everybody to the City of Citrus Heights remote Facebook Live series. I'm Nicole Baxter, Communications Officer for the city, and today I'm excited to be interviewing Dr. Kimmy Hart, a pediatrician with Dignity Health Mercy Medical Group, the relatively new medical office building on Greenback. So, hi, Dr. Hart. Thanks for joining us today.
Nicole, thanks for having me.
So to get us started, we'll be talking today about the importance of flu shots, especially amidst the pandemic. And it's kind of great timing to have this conversation with you because the city is partnering with the county to host a free flu shot clinic this Thursday, the 12th from 11 to 2. And to get us started, I was hoping, Dr. Hart, you could talk us through the importance of flu shots.
Yeah, well, that's great. I'm excited that they're doing that this week. It's really good timing. So as you all know, this season, we're going to have two major respiratory illnesses going around. So COVID-19 and influenza. And you don't want to get both of them. So the best way to reduce that risk is to get the flu vaccine because it can really reduce symptoms if you do get exposed to the flu. And that'll help also reduce the burden on healthcare systems by reducing the amount of people that are hospitalized.
And can you get the flu or can you get COVID if you've had one or the other?
Yeah, you can get both at the same time, and that can be really devastating. And so we definitely don't want that to happen. So the best chance at reducing that is to get the flu vaccine.
And I know that I think flu season starts in October, so we're kind of headed towards the middle of November. Is it still a good time to get flu shots?
Yeah, it's not too late. Yeah, we typically see the flu starting to go around the community in September, and then it can last, towards May. Even sometimes we see some infections in June. It typically peaks around December, January time. So definitely get your flu vaccine as soon as possible. It's not too late, even any time during the season, but we do typically recommend getting it in October to help reduce those symptoms as early as possible. And the vaccine does take 2 weeks to get its full effectiveness. So it's especially important to get it early for that reason.
Gotcha. And for those that are hopefully going to tune in, ask their questions live, and then go get their flu shots this week, is there any advice you can give parents, since you are a pediatrician, for making the flu shot experience maybe a little easier for parents?
Yeah, so you know your kids better, but sometimes giving them a little bit of a warning that we're going to go get your flu vaccine, tell them that it's going to make you nice and strong and help prevent you from getting sick. And sometimes, encouraging them with a little reward, maybe afterwards, to give them something else to focus on.
That's great. And so if you're joining us, we are live interviewing Dr. Kimmy Hart from Dignity Health Mercy Medical Group right here in Citrus Heights. We will be taking your questions about the importance of flu shots. So my colleague Haley Reed is watching our comment section live. So if you have comments, please type them in there and we'll take them at the end of this interview. So Dr. Hart just walked us through the importance of flu shots, some tips for parents around making flu shots maybe a little bit easier on kids. So next, I'd love for you to cover the symptoms of flu. I know, at least for me personally, every little sniffle from the allergies, I'm already paranoid. So what are some of the ways individuals can tell if they've got the flu versus if they've got the cold?
Yeah, so we do still have other cold viruses going around, as much social distancing as we can do and wearing masks. We do still get sick, and especially kids get a lot of colds during the season. So you want to make sure that that you're Sorry, can you repeat that question?
Yeah, I think you're headed to talk about preventing the spread of flu,
Yeah,
which I would love to touch on
yeah,
that first, and then we
got a
can go
little
into
ahead
the
of
second
myself.
one. That's
So
fine.
the symptoms of the colds and the flu. Flu symptoms are typically a little more severe. So colds, you get, like you mentioned, the sniffles, and you can get a cough, and you can even get a fever. But fevers are typically more consistent with flu. And then you get a little more severe symptoms such as body aches and chills.
Gotcha. So if someone is getting that fever and it feels more intense, so what's your recommendation for them, in the middle of a pandemic, if you think you have the flu, what should you do?
So definitely, if you have mild symptoms, I would stay home so that you don't infect other people. And then call your or contact your provider's office and see what they recommend based on the symptoms that you're having.
That's great. And then I think you were talking earlier about ways to prevent the flu. So I feel like our community here in Citrus Heights is pretty well trained. We've been doing a good job with our public health orders, masking. But what are some of the extra steps we should be taking to prevent the spread of flu?
Yeah, so a lot of signs about washing hands, so that's definitely important. For sure, wearing your masks as much as possible when you're outside and around other people. But there are times where you're not going to wear your mask when you're at home or, with your group of people that you've been around. And there are some people that can't wear masks due to medical conditions or, age, children under 2. So just make sure you're practicing as much as possible the masking and social distancing and washing hands.
That's great. So I think you've covered the questions that I had for you. I'd like to invite Haley on, who's monitoring our comment section. And we were taking questions via email all week long. Haley, were there any that you felt like we should address?
Yeah, so we had a couple come in this week. I think you've kind of touched on this, but I will just go ahead and ask again.
Sure.
Is it too late to get the flu shots for my family?
No, it's not too late. So I would get them as soon as possible. And for future years, October is usually a good time to get them. But definitely, if you haven't gotten them yet, I would try to get them this week or, maybe before the next couple weeks are over.
Yeah, and then I did post information. The City of Citrus Heights is hosting a flu clinic on Thursday. So that link is in our comments if you have any other questions about that. But I do have one other question that came in. How long is the flu season?
So there's a range of the length of the flu season, but typically ranges from about September to May. We do see some infections even later on in June, and it typically peaks around December to January time.
Awesome. And then we had one question roll in from
Yep.
Brooke. Can you get the flu from the flu shot?
Great question. You cannot get the flu from the flu shot. It is an inactivated part of the virus. Some people do get some body aches from the flu vaccine, and that is a normal side effect. Sometimes you can get a mild fever as well. Sometimes you can get a little swelling or redness where the shot was given. And the other reason some people think that you may get the flu is because the vaccine takes 2 weeks to become effective. So if you are exposed to the flu before the vaccine is fully effective, then you can get the flu and have some symptoms from that.
Perfect. And then that's it for the questions that I've received.
Great, thank you.
Thanks, Haley.
Ladies.
So Dr. Hart, before we head into kind of your closing thoughts, I'd love for you to reiterate again the importance of flu shots this season.
Yeah. So this season, we have a couple viruses going around, COVID-19 and influenza. So we definitely want to decrease the risk of you getting both of those infections at once, which can happen, and that would be bad. So definitely get your flu vaccine this year, especially.
And then I love the sentiment you shared earlier around you don't get the flu shot for yourself. So I think if we've taken all the community questions, we'll go ahead and head into your final thoughts for our viewers, kind of a message you want to leave them with.
Yeah, so the flu vaccine doesn't only protect yourself from getting infected. If you do get the flu, it reduces your chance of spreading it to other people. So protect your pod and get the flu vaccine.
Absolutely. Well, thank you so much for your time today. I can only
Yeah.
imagine how busy you guys are. So if you're joining us a little late, don't worry. We will have a recording of this interview up and you can watch it. You can still ask us your questions. If you have county health related questions for our free flu clinic that the city is hosting, we will drop that link into the comments section. So that's this Thursday, November 12th from 11 to 2. You can head over to the Citrus Heights Community Center and get a free flu shot. And then also Dr. Hart is in the Mercy Medical Group Dignity Health Building right there on Greenback in Citrus Heights. And you guys have flu clinic information as well. So we will share both sets in the comment section. And like I said, keep those questions coming for us. And until next time, well, thank you for joining us. And thank you, Dr. Hart, so much.
Thank you so much.
All righty, bye-bye.